Welcome to the deep dive. You've brought us some really crucial source material today, taking us deep into a challenging health issue for dogs and cats, calcium phosphate urolithiasis.
Yeah, that's right.
These are, well, the specific kind of urinary stone, right? And they can cause some real problems.
They definitely can. And while maybe not as common as, say, struvite or calcium oxalate stones, these calcium phosphate ones, CP stones we sometimes call them, they have some unique characteristics, makes them particularly complex.
Absolutely. So our mission here in this deep dive is to really comb through these sources you've provided, pull out the essential knowledge and figure out, what are these stones? Why do they form? How do we find them? How do we get rid of them? And the really critical part, how do we stop them coming back? We want to make this complex topic clear, actionable for you.
And, if there's one single sort of game-changing fact that defines how we approach CP stones, it's this. You just cannot medically dissolve them.
Really? Not at all.
Nope. Not with anything we currently have available.
Yeah.
Unlike some other stones, where maybe diet or meds can melt them away. These need physical removal.
Wow.
And that fact, it shapes everything. Diagnosis, treatment, lifelong management, everything we'll talk about.
Okay, right. Let's unpack this challenge then. First off, what exactly are these calcium phosphate uroliths?
Well, at its simplest, urolithiasis just means stones forming somewhere in the urinary tract.
Right. Stones.
And calcium phosphate uroliths are just one specific mineral type. Your sources mentioned they show up in a few different crystalline forms in dogs and cats.
Like different structures.
Exactly, like calcium phosphate apatite, calcium phosphate carbonate. And then there's calcium hydrogen phosphate dihydrate, which is also known as brushite.
Brushite.
And there are less common ones too, like whitlockite and octocalcium phosphate. But think of those names as just, describing slightly different ways the calcium and phosphate minerals can stack together when they crystallize.
Got it. Different flavors of calcium phosphate stones. And looking at the data you shared, like from the Minnesota Urolith Center, they seem relatively uncommon overall.
They are, yeah. Based on that data, they're less than 1% of stones submitted from dogs and less than 0.5% from cats. So not huge numbers overall.
Okay.
But what's really interesting, though, is where they tend to show up. A noticeably higher percentage of these CP stones are found in the upper urinary tract.
Meaning the kidneys.
Yeah.
And the tubes going down.
Exactly. Kidneys and ureters, those tubes leading to the bladder. Compared to stones found lower down in the bladder or urethra, the data showed about, 3.5% of canine and 2.5% of feline CP stones were found up there.
So proportionally, they're more likely to be kidney or ureter stones than, say, bladder stones compared to other types. That's a key distinction.
It is.
And what do they actually look like, if you could see one?
Usually they're kind of cream or tan colored.
Yeah.
The brushite type, that one's often described as typically round and smooth, almost like little pebbles.
Pebbles.
Yeah. Other CP types don't seem to have one single signature shape, though. And a striking detail from the sources is that sometimes mineralized blood clots that contain CP can actually appear black.
Black stones. Wow. That's certainly memorable. Okay, so who typically gets these? Which animals and what signs might you see in your pet?
Well, they can happen in both dogs and cats. But it's rare, very rare, to see them in animals younger than about a year old.
Okay, so older animals generally.
Generally. And there's a specific note in the sources about one form, the calcium phosphate carbonate, or CPC. It shows a really strong predisposition for female dogs.
How strong?
Something like 72% of those specific stones were found in females, according to the data.
72%. That's a huge skew towards females for that one type. Any idea why? Did the sources say?
They don't dig too deep into the why for that specific CPC skew, but it's often linked to certain types of urinary tract infections.
Yeah.
And female dogs can just be more prone to UTIs in general.
Ah, okay. That makes sense. So the signs a pet shows, they'll really depend on where the stone actually is located.
Exactly. Completely depends. If the stones are lower down bladder or urethra, you might see those really classic signs. Things that look a lot like a urinary tract infection, actually.
Like what?
Increased frequency of urination.
Yeah.
Wanting to go out all the time. That's pollakiuria. Painful urination, maybe yelping or straining dysuria, obvious blood in the urine, hematuria.
Draining.
Yeah, straining to urinate, stranguria, or sometimes just having accidents in the house,
Yeah.
inappropriate urination.
Okay. And this is where we get into that really serious situation, right? The blockage, urethral obstruction.
Absolutely. A stone lodged in the urethra blocking the flow of urine, that is a life-threatening emergency. Full stop.
And the sign there is?
The most alarming sign is persistent, often painful, straining with little to no urine actually coming out. That's the big red flag.
Okay, straining, no urine, emergency.
Right. And you might also see the pet becoming lethargic, maybe off their food, vomiting, or even collapsing. And this obstruction, it's much more common in male animals,
Why males?
just anatomy.
Yeah.
Their urethras are narrower and longer, so they block more easily.
Okay. So if you see your pet straining, little or no urine-produced vet, immediately. What about if the stones are higher up? Kidneys or ureters?
Yeah, stones in the kidneys, nephroliths or ureteroliths, they're often silent, sneaky.
Silent, meaning no sign.
Often, yeah. They might just be found incidentally, if you're doing an X-ray or ultrasound for something else entirely. But they can cause problems like intermittent or persistent blood in the urine.
Okay.
Or if they cause an obstruction higher up or lead to an infection, then you might see signs. Things like lethargy, loss of appetite, maybe vomiting, sometimes pain that shows up as tenderness in the belly or flank area.
Yeah.
And if a kidney gets completely blocked, it can swell up with urine. That's called hydronephrosis. And a vet might even be able to feel that enlarged kidney. And long-standing damage for these upper tract stones can also contribute to chronic kidney disease down the line.
So the signs can range from, well, nothing you'd notice, all the way to a dire emergency. Depends where these sneaky stones decide to lodge.
Exactly.
Which brings us to the core question, why? Why do these calcium phosphate stones form in the first place? What's going on chemically in the urine?
Fundamentally, it's about the urine becoming overloaded.
Yeah.
Supersaturated is the term. Too much calcium, too much phosphate dissolved in there.
Like too much sugar in tea.
Exactly like that. Eventually, it can't stay dissolved, and it starts to precipitate out as crystals. And in the urinary tract, these crystals can clump together, grow, and form stones.
Supersaturation. Okay, so what are the main factors that push the urine towards that state for calcium phosphate specifically?
Several things. Urine pH is a huge one. Calcium phosphate formation is strongly promoted by alkaline urine, high pH.
Alkaline, so not acidic.
Right. Typically a pH above about 7.5. Calcium phosphate is actually much more soluble, stays dissolved better in acidic urine.
So alkaline urine is definitely not your friend if you want to avoid these stones. What else contributes?
High levels of calcium in the urine. Hypercalciuria. That's a really significant contributor.
Okay, high calcium.
And that can happen for a couple of reasons. Either there's too much calcium in the blood generally, which then spills over into the urine, that's hypercalcemia.
Right.
Or sometimes the blood calcium is actually normal, but the kidneys just excrete too much calcium anyway. That's called idiopathic hypercalciuria.
Wait, hang on. So even if the blood test for calcium is normal, they can still have too much calcium in their urine.
Exactly. Yeah, that's one of the complexities. The kidneys are supposed to regulate what gets kept and what gets peed out. In idiopathic hypercalciuria, for reasons we don't fully understand, they seem to just leak too much calcium. But if the high urine calcium is because of high blood calcium, well, the sources list several potential causes for that. Things like primary hyperparathyroidism, a little gland problem.
Parathyroid gland?
Yep, the ones that regulate calcium. Or certain types of cancer, like lymphoma or a specific kind of anal sac cancer. Or sometimes just getting way too much vitamin D. Or in cats, sometimes it's just idiopathic hypercalcemia, high calcium for no reason we can find.
Wow, okay. So investigating high calcium is crucial. What about the phosphate part?
Increased phosphate excretion in the urine, hyperphosphaturia, that also plays a role. And then there's just simple concentration.
Meaning?
Less water intake, more concentrated urine, higher specific gravity, we call it. That means there's less liquid to keep all those minerals dissolved, making supersaturation more likely. Just basic physics, really.
Makes sense. More concentrated, more likely to crash out.
Right. And sometimes the body might just not produce enough of the natural substances that normally help prevent crystals from forming. We call those inhibitors. If you're low on inhibitors, stones are more likely.
Are there other underlying health issues that pot up in the sources besides the hypercalcemia causes?
Yeah, the sources note the conditions like hyperadrenocorticism, Cushing's disease, or even long-standing chronic kidney disease can sometimes be associated with CP stone formation. The exact links aren't always straightforward, though.
Complex body systems interacting. And what about infections? Do UTIs play a role here?
They definitely can, especially with that calcium phosphate carbonate form, the CDC one we mentioned earlier.
The one more common in females.
That's the one. Urinary tract infections caused by specific bacteria like Staphylococcus or Proteus species. These guys produce an enzyme called urease.
Urease.
And what urease does is break down urea in the urine. And a byproduct of that reaction makes the urine sharply alkaline, really high pH.
Ah, creating that perfect storm for CP formation.
Exactly. That alkaline environment strongly favors CPC formation. So the sources say, increased calcium excretion plus one of these specific urease-producing UTIs, that's a known risk factor for CPC.
Got it.
And it's also worth mentioning, CPC can sometimes be found as a minor component mixed within struvite stones, which can complicate how you manage those mixed stones.
Okay, so a UTI with the right or wrong bacteria can really drive up the pH. Now, you mentioned earlier those black stones, the mineralized blood clots containing CP. Is that a different process than these metabolic issues?
Yes, the sources make a distinction there. Pure CP uroliths, the tan or white ones, are usually linked to those metabolic problems we've been talking about, hyperparathyroidism, kidney tubule issues, maybe diet.
Right.
The CP mineralized blood clots, on the other hand, that suggests something called dystrophic mineralization. Basically, minerals are depositing onto tissue that's already damaged or dead, like a clot.
So mineralizing damaged stuff rather than a body-wide metabolic issue causing minerals to deposit everywhere.
Exactly. That body-wide issue driven by abnormal metabolism, that's more like metastatic mineralization. So it's a slightly different mechanism for the clot-based stones.
Okay, that distinction helps clarify things. So we know what they are, roughly why they form, the signs they cause. How does a vet actually figure out definitively that these are calcium phosphate stones and not something else? What's the diagnostic journey look like?
It's definitely a process, a bit of detective work. Starts, as always, with the history you give about the signs you've noticed and a thorough physical exam. The vet's going to be thinking about other common things too, of course.
Right.
Like a simple UTI without stones, other types of urinary stones, struvite, calcium oxalate, silica, or even something like a tumor in the urinary tract causing similar signs. Or maybe just mineralization of the bladder wall itself.
Okay, ruling things out. Then comes the lab work.
Absolutely. Urinalysis is essential. First stop.
What do you look for there?
Well, you might see abnormalities like blood, white blood cells, protein. Sometimes you can actually see calcium phosphate crystals under the microscope.
The actual crystal.
Yeah, maybe amorphous phosphate, which just looks like debris, or apatite, or sometimes those distinctive elongated rectangular sort of lath-shaped crystals that are characteristic of brushite.
Right, the brushite ones.
And crucially, the urine pH on the urinalysis is typically found to be alkaline or neutral, which fits perfectly with what we know about how they form.
Okay, what else?
A urine culture and sensitivity test, also mandatory, really. You have to check for a concurrent bacterial UTI, and if there is one, identify the specific bacteria and see what antibiotics work. Finding those urease-producing ones like staph or proteus is especially important if you suspect CPC.
Got it. Culture is key for UTIs.
Yeah.
And blood work, what role does that play?
Blood work, like a CBC and biochemistry panel, it's often unremarkable unless there are complications like severe obstruction or kidney damage, but it's vital for checking kidney function, BUN and creatinine and electrolytes.
Yeah.
And this is critical blood work is where you screen for that underlying hypercalcemia. You need to check both total calcium and, ideally, ionized calcium levels.
Ionized calcium, why? Both.
Ionized calcium is the biologically active form, and sometimes total calcium can be normal while ionized calcium is high, or vice versa, due to protein levels and things. So checking both gives the full picture. And if hypercalcemia is found,
Then more tests?
yep, then you need further tests, like measuring parathyroid hormone, PTH, and something called PTH-related protein, PTHRP. Those levels help pinpoint the cause of the high calcium. Is it parathyroid glands? Is it related to certain cancers? Or something else. The sources do point out, though, that sometimes hypercalcemia or signs of kidney trouble, azotemia, aren't actually detected unless there's a complete blockage.
So blood work helps find those potential metabolic drivers. Okay, how do we actually see the stones themselves? Imaging.
Exactly, imaging is key. And thankfully, calcium phosphate stones are typically radiopaque.
Radiopaque, meaning they show up on x-rays.
Yep, they're dense, similar to bone density, so they usually show up quite well on standard abdominal x-rays. Radiographs are great for finding them, seeing where they are, how many, how big.
Okay, so x-rays are a good starting point.
Definitely. And abdominal ultrasound is also incredibly valuable. It can detect stones, whether they show on x-ray or not, those CP usually do, and it gives a fantastic view of the kidneys and bladder themselves. Checking their health, looking for signs of obstruction like dilated kidneys, hydronephrosis, or dilated ureters, hydroreader.
Ultrasound gives more detail on the organs.
Right. And for the absolute most sensitive imaging, especially for tiny stones, or really getting a detailed look at an obstruction, that would be a CT scan. And sometimes using a scope, like cystoscopy, lets you look directly inside the bladder and urethra to see stones.
Okay, lots of ways to visualize them. But your sources really hammer home one single step as the only way to be absolutely certain about the diagnosis, right?
Yes, this is probably the most critical diagnostic point to emphasize. Imaging tells you if stones are there and where they are. But quantitative analysis of retrieved uroliths,
Meaning sending the actual stone to a lab.
exactly, sending the removed stone or fragments to a specialized diagnostic center, like the Minnesota Urolith Center mentioned in the sources.
Hmm.
That is the only way to definitively confirm the exact mineral composition.
And why is that so important?
Because knowing the precise makeup, is it pure CP apatite? Is it brushite? Is it mixed with something else? That information is absolutely essential for designing the correct long-term prevention plan. You simply must get the stones analyzed. It dictates everything that comes next.
That makes total sense. You have to know exactly what you're fighting. Okay, so we found them. We've confirmed via analysis they are calcium phosphate stones. How are they treated? We already know medical dissolution is off the table.
Right, that's the big hurdle. Since we can't just dissolve them with medication, treatment really focuses on two things: physically removing the stones that are causing problems, and then putting a really robust plan in place to prevent new ones from forming.
Okay, let's talk removal first. What about those emergency situations, like a blockage?
Right. For a urethral obstruction, a blockage in the tube leading out, that's code red, emergency, requires immediate action to get urine flowing again.
How do you do that?
Techniques include trying to flush the stone backward into the bladder using fluids under pressure. That's called retrograde urohydropropulsion. Or passing a urinary catheter past the stone, if possible.
Flush it back or bypass it?
Yeah. And the sources mentioned some newer techniques too, like using a laser through a scope lithotripsy to break up stones right there in the urethra, or using tiny baskets, again through a scope, to grab and remove them. These minimally invasive options can sometimes help avoid more disfiguring surgeries like cutting the urethra open,
Right.
though sometimes that is necessary.
What if the blockage is higher up in a ureter, that tube from kidney to bladder?
Urethral obstruction is also a very serious emergency. It can quickly damage the kidney. So treatment involves aggressive IV fluids, good pain management, and often surgical intervention is needed fairly urgently.
Surgery.
It might involve cutting into the ureter to remove the stone ureterotomy, or sometimes more complex procedures like rerouting the ureter into the bladder differently, ureteroneal cystostomy, or even placing a special implanted device, like a SUB device, which is basically a subcutaneous bypass tube that lets urine drain from the kidney directly to the bladder, bypassing the blocked ureter entirely.
Wow, those sound like major specialized procedures.
They can be, yeah, often require referral to a surgical specialist.
Okay, so that's emergencies. What about removing stones that aren't causing an immediate crisis? Maybe bladder stones causing irritation or kidney stones causing issues but not blocked.
For smaller stones, particularly in the bladder of female dogs where the urethra is shorter and wider, a procedure called voiding urohydropropulsion can sometimes work.
How does that work?
It's done under anesthesia. You fill the bladder up with saline, hold the pet upright, and then manually squeeze the bladder firmly to try and flush the small stones out through the urethra. Works best for stones under maybe 3 or 4 millimeters.
Flush them out.
Yeah. But the most common and often most definitive method for removing bladder stones is surgery, a cystectomy. Just surgically opening the bladder and physically removing the stones.
Okay, straightforward surgery. Are there minimally invasive options here too?
There are, yes, though they often require specialized equipment and expertise. You can use cystoscopy, that camera scope, again with a laser fiber to go in and break up bladder stones. That's laser lithotripsy.
Break them up inside.
Right. Or use those small baskets inserted through the scope to grab stones. And for stones higher up, in the kidney or ureter, that aren't causing an acute blockage but maybe need to come out, there's extracorporeal shockwave lithotripsy, ESWL.
Shockwaves.
Yeah, using focused shock waves delivered from outside the body to fragment the stones inside the kidney or ureter so the smaller pieces can then be passed or removed more easily.
Okay, so quite a toolbox for physical removal, from flushing to surgery to lasers and shockwaves. But since we can't just give a pill to make them go away, preventing them from coming back, that's really the name of the game long term, isn't it?
Absolutely critical. Prevention is all about lifelong medical management, and the goals are basically threefold.
Which are?
1, address any underlying metabolic issues, especially hypercalcemia if it's present. 2, make the urine very, very dilute. And 3, maintain a moderately acidic to neutral urine pH. Actively avoiding alkaline urine, because that's the danger zone for these stones. The target pH is usually somewhere between 6.5 and 7.5.
Dilute urine, manage calcium, avoid high pH. How do we actually achieve those goals?
Dietary management is the absolute cornerstone of prevention. Feeding a prescription therapeutic diet, one specifically formulated for stone prevention, is highly recommended.
What's special about those diets?
Well, your sources heavily stress the importance of increasing the moisture content. Canned food is ideal. Or adding a good amount of water to dry kibble.
Why so much focus on water?
Because this is crucial. It significantly dilutes the urine, makes it much harder for those calcium and phosphate ions to reach that supersaturation point where they start crystallizing out. The target is a low urine-specific gravity, like less than 1.021 in dogs, less than 1.030 in cats. Very dilute.
Dilution is the solution, partly.
To a large extent, yeah. These diets also typically have controlled moderate levels of protein, calcium, and phosphorus. The idea is to reduce the concentration of these stone-forming minerals in the urine, but without causing nutritional deficiencies.
So not necessarily low calcium.
Not aggressively restricted, no, unless hypercalcemia has been confirmed. The sources caution against that. Some diets might also contain ingredients to help nudge the urine pH towards that slightly acidic to neutral target range, which discourages CP formation. But again, the sources caution against aggressive acidification, because that could push things too far the other way and increase the risk of forming calcium oxalate stones, which is a whole different problem.
Tricky balance then. Okay, so hydration and the right prescription diet are paramount. What about things like treats, supplements?
Yeah. Definitely need to be careful there. Avoid high calcium treats and supplements, things like dairy products, actual bone, high calcium supplements, or giving excessive vitamin D stick to treats compatible with the diet plan.
Okay.
And actively encourage water intake any way you can. Multiple water bowls, maybe a pet fountain. Definitely feeding wet food helps hugely.
And if that underlying hypercalcemia is present, treating that seems like it would be the single most impactful thing for prevention.
It is absolutely paramount. If high blood calcium is driving the stone formation, you must identify and treat that root cause, whether it's surgery for a parathyroid issue, treating the underlying cancer, or implementing specific dietary strategies for those idiopathic cases in cats. Correcting the hypercalcemia often provides the biggest bang for your buck in minimizing future stone risk. It removes a major driver of that supersaturation.
Makes sense. Attack the root cause. Are there any medications sometimes used specifically for prevention beyond treating the underlying cause?
For really tough recurrent cases where maybe diet and managing hypercalcemia aren't quite enough on their own, hydrochlorothiazide diuretics might be considered.
How do those help?
They basically work by reducing the amount of calcium the kidneys excrete into the urine, so less calcium going into the urine pool. But they do require careful monitoring for potential side effects, like low potassium levels. So not usually a first-line thing, but an option.
Okay, so physical removal first, then a lifelong battle plan centered on diet, hydration, managing hypercalcemia if it's there, keeping pH right, and maybe medication in some cases. What's the long-term outlook, and what kind of monitoring is needed?
The prognosis for successful removal of the stones is generally pretty good, assuming the procedure goes well. However, the prognosis regarding recurrence, that's more guarded.
Meaning they often come back.
They can, yeah, if those underlying factors aren't meticulously managed. Your sources emphasize that recurrence rates can be significant if the preventative measures, especially the diet, the water intake, addressing hypercalcemia, aren't strictly followed, or if the underlying cause just can't be fully controlled. Lifelong prevention really is essential.
And does the location where the stones were matter for the long-term outlook?
It can, yes. Prognosis for, say, urethral obstruction is generally good if it's relieved promptly, but the risk of recurrence means you always need that ongoing vigilance. For urethral obstruction, though, the prognosis is often more guarded.
Why guarded for the ureter stones?
Because of the potential for irreversible kidney damage that can happen even before the stone is successfully removed, and just the overall complexity of the surgical interventions sometimes needed up there.
Right. So consistent, diligent monitoring seems absolutely key to catching any potential recurrence early, while it's maybe easier to handle.
Crucial. Absolutely crucial. First step, as we said, must submit the removed stones for that quantitative analysis. Know thy enemy.
Right. Stone analysis first.
Then, right after removal, usually within 24 hours, get follow-up x-rays to confirm all the stones are actually gone. Don't want to leave any fragments behind.
Good point. Check the work.
Then, for ongoing monitoring, regular urinalysis and urine cultures, maybe every 1 to 3 months initially. then stretching out to every 3 to 6 months, lifelong.
What do you check in with those?
Checking the urine pH, making sure it's in that target range, checking the specific gravity, making sure the urine is staying nice and dilute, looking for any new crystals, and importantly, screening for any returning UTIs, especially those urease-producing ones.
Okay, urine checks regularly. What else?
Regular imaging, either radiographs or ultrasound. Again, maybe every 3 to 6 months initially, then perhaps every 6 to 12 months lifelong. The goal here is to detect any new stone formation when they are still small, hopefully before they cause a major problem.
Catch them small.
Exactly. And periodic blood work is important too. Rechecking kidney values, electrolytes, and especially rechecking those ionized calcium levels, particularly if hypercalcemia was an issue initially.
Wow. That sounds like a really significant commitment for pet owners, a real partnership with their vet team. What are the absolute key takeaways owners need to walk away understanding?
Yeah, it's a big commitment. Based on the sources, the critical points to communicate to really make sure land are: 1, these specific stones cannot be medically dissolved. They require physical removal. 2, prevention is lifelong and absolutely essential to try and avoid recurrence.
Lifelong cut.
3, treating any underlying hypercalcemia, if it's present, is paramount. It's often a major driver. 4, strict adherence to that prescribed therapeutic diet and maximizing water intake. Those are non-negotiable cornerstones of prevention.
Diet and water are king.
Pretty much. 5, owners need to know the signs of recurrence and crucially understand that straining with no urine is an absolute emergency. Get help immediately. 6, transparency about the potential costs involved: diagnosis, treatment, lifelong monitoring, and food that's important too. And finally, don't hesitate to refer complex cases to specialists if needed.
It really underscores that managing calcium phosphate urolithiasis isn't like a one-and-done thing. It's a continuous effort, isn't it? A true lifelong management plan, a battle plan against these stubborn stones.
Exactly. That's a good way to put it. It requires real diligence and a multifaceted approach, hitting all the pieces of the puzzle: the diet, the hydration, managing any underlying conditions, and that regular ongoing monitoring.
You know, this whole deep dive into calcium phosphate urolithiasis, it powerfully illustrates something broader, doesn't it? How maintaining a really delicate internal balance, like carefully controlling urine pH and mineral levels through things like diet and hydration, can have such a profound impact, preventing these painful, potentially life-threatening conditions. It's just a reminder of how intricate the body's chemistry is and how vital keeping it in harmony really is for health.
Indeed, it's a very complex system, and even small disturbances in that balance can have significant consequences, sometimes, well, literally stone-forming consequences.
Well, thank you for bringing this incredibly important and clearly complex topic forward for us to explore today.
My pleasure. It's definitely an important one.
And thank you for joining us for this deep dive. We hope this helps, and we encourage you to keep exploring, keep asking questions about health for yourself and for your pets.